Nigeria is the most populous country in Africa and the seventh most populated in the world. With over 350 ethnic groups with different cultures, different characteristics.
As the Carter Center's Adamu Salau reels off the challenges to tackling Nigeria's health problems, it's this fact about his country that hits hardest. Nigeria has the greatest number of people in all of Africa infected with neglected tropical diseases.
We believe that we should not allow anybody in our communities to have all of these neglected diseases, because now we know what to do and we're in a position to offer assistance.
2 tablets.
For decades, the Carter Center has provided assistance to Nigeria's Federal Ministry of Health to expel diseases rarely mentioned in developed countries, but a daily reality for millions of Nigerians.
The Carter Center began working on guinea worm disease in Nigeria in 1988. The disease was eliminated from Nigeria in 2008.
Today, the center fights river blindness disease, schistosomiasis, trachoma, malaria, soil-transmitted helminths, and has helped Nigerians topple lymphatic filariasis in the states of Plateau and Nasarawa, where transmission has stopped. What isn't stopping is the momentum to reduce the country's burden of disease, as Nigeria's Federal Ministry of Health zeroes in on malaria and lymphatic filariasis.
Nigeria is the first country in Africa to really put forward strong recommendations for these two programs to work together to eliminate malaria and lymphatic filariasis.
And the Carter Center scales up drug treatments across 9 states.
We just treated about 9.3 million people the last year. For this year, 2014, we should be treating about 35 million people. That's a big expansion.
Expansion made possible by support from a coalition of partners and community-based health workers, and by an innovative Carter Center effort to bundle health services, tackling 3 or more diseases at once through safe, effective, economical mass drug delivery and health education.
The goal is to help lift as much of the burden of these diseases off the backs of these people in the rural communities so they can get about their business of supporting themselves, raising their children, and contributing to their communities and to the world.